Well, across the country, people continue to protest as we await a ruling from the U.S. Supreme Court possibly overturning Roe v. Wade.
That draft opinion showing the high court could put abortion rights in the hands of the states. It was leaked earlier this month. Now some Texans are wondering if the state will provide more resources for pregnant women. Here's KVUE's Tanvi Verma.
Becoming a mom can be one of the greatest life experiences, but it can also be one of the greatest costs. In 2018, almost half of the babies born in Texas were born to moms on Medicaid. And Paula Saldana with the National Latina Institute for Reproductive Justice says an overturning of Roe v. Wade could make it harder for those moms.
As it is, a lot of our federally qualified health centers that do take Medicaid have waiting lists for a lot of services, especially reproductive health care.
Potentially making it harder for people to get a spot in line for reproductive health resources. And according to a 2021 Guttmacher Institute report, Texas is almost a quarter uninsured, making it #1 in uninsured women of childbearing age. Saldana says many pregnant women who are uninsured will have to visit emergency centers.
Can foresee long wait lines at the emergency centers as well, and people accessing it to be able to get the help they need at that moment.
But Amy O'Donnell with Texas Alliance for Life says the state has made it a priority to help moms at least pay for care.
The legislature increased funding for the Alternatives to Abortion program up to $100 million for the biennium. And those funds go towards maternity homes, pregnancy centers, and adoption agencies across the state.
The Texas Adoption Center says if there's an influx of expecting mothers, they will have the resources to help connect women with adoptive families.
We have many adoptive families that are ready and waiting and able to provide homes to newborns. And so we would be able to handle an increase in expectant mothers reaching out to our agency.
While there are resources for expecting mothers, the future of federal abortion rights is still unclear. For KVUE News, I'm Tanvi Verma.
Now, with that Supreme Court draft opinion leak indicating an end to Roe v. Wade, companies are under pressure to adopt more favorable employee policies with respect to women's reproductive rights. We spoke with a corporate employee rights expert. He tells us how companies may move forward with health care benefits and how taking a stand on the matter could be very important.
We're in pretty much the fiercest competition for employee talent that we've seen in decades. And as a result, what you're going to see is a lot of employers are going to be put to the test of trying to figure out what is the best way to recruit and retain talent when they are located in jurisdictions that are going to have more restrictive abortion laws.
Some big name companies, including some in Austin, are already speaking out or announcing changes to their benefits policies. That's during state-led efforts to restrict or ban abortions. Experts in corporate responsibility say it may be in the best interest of businesses to address reproductive rights, noting future employees and the customer base will pay attention.